The president, in a televised address in June, announced that all frontline health workers will receive an additional allowance of 50% of their basic salary per month for March, April, May, and June. Updating the House on the COVID-19 situation in the country, Dr. Bernard Okoe Boye said 6,000 health workers have been classified as frontline staff.
This list, which currently stands at approximately 6,000 workers, is one that can change depending on cases confirmed in facilities and the number of people involved in the management. I am happy to mention that 6,000 health workers that were vetted and validated as having been in direct management of confirmed COVID cases have had their 50% basic salary for the month of April hit their accounts. Any health worker that is determined as having managed a COVID case but not being in the current list would be evaluated and captured if in the reviewed list. The list is a dynamic one that changes with the current situation. The commitment to health workers by the Akufo-Addo government remains unadulterated, firm in its creation and focused on its efforts to overcome this pandemic. Mr. Speaker, the Ministry of Health and all relevant stakeholders have sat and settled on who qualifies as a frontline worker.
Contributing to the statement, members of the minority demanded accountability from government on the expenditure for the management of the COVID-19 situation.
As for demanding accountability on COVID resources, the day will come, because you are not Minister for Finance. We've heard your report of $34.5 million being spent. We will ask for accountability on the $1 billion, the $100 million, and the $290 million, as and when it's appropriate. So, Mr. Speaker, I should commend the maker of the statement, at least for sharing it.
We have been warned repeatedly, that it is in this pandemic that we have to hold our governments accountable. Because the propensity, the likelihood, the possibility, probability, like the majority says, of government taking advantage of the situation and dissipating our resources with careless abandon is there. It's rife. It's rife. Because they now have an opportunity anytime we call for account to say coronavirus. And that is why we must be concerned. That is why we must be concerned that when the minister comes here on Thursday, because we've eaten the meat to the bone, there are no resources. We've eaten the meat to the bone.
Minister for Monitoring and Evaluation, Dr. Anthony Akotose, who spent 3 months outside the country due to the closure of borders, shared his experience with the House.
I happen to be coerced into a self-quarantine in the States for over 3.5 months. So I happened to study what was happening in the States. And the problem in the States is very simple. There's no consistency between the leadership of the country and the rest of the public. A head of state says that he won't wear a mask. And it's part of the protocol that's been given by the CDC. Just 2 days ago, the governor of Georgia is suing the mayor of Atlanta for obeying CDC guidelines. So the public in the US is confused. They are. I'm glad that, at least in Ghana, there appears to be some consistency in the messaging of the issue in the leadership. I think we should continue.
Vice Chairman of the Defense and Interior Committee of the House, Collins Owusu-Amankwa, later responded to claims from the minority on allegations of secret recruitment into the security services of the country.
Best of my knowledge, yes, that is what is being done as we speak. That there's a backlog, and that is what they are doing, and I'm surprised. Well, it could be a diversion tactics, because, you know, when Interpol issued a publication on red notice, minority leader wanted to divert the attention of Ghanaians. So he just, just to push out the story, just to divert the public view on the Airbus saga, which for me justice would definitely be served on the good people of this country. When you say diversion tactic is part of politics, yes, it's part of politics, but I don't subscribe to that. I believe we ought to be serious when it comes to issue of importance or issue of public importance.
Deputy Minister of Health, Dr. Bernard Okoe Boye, today briefed the House on progress made by government in tackling the coronavirus pandemic in the country. Members of the House have requested for many more briefings, particularly, if possible, on a weekly basis to update the country and the House on the situation. Reporting for Citi News from Parliament, my name is Duke Menton Poku.